So dental implants have evolved a lot. We have created advanced implant restorations, advanced surgical procedures. We got zygomatics, we got sinus lifts. But let's say that you are not a candidate, or let's say that you have an autoimmune problem. Let's say you're a diabetic and your glucose is out of control. Well, then we can provide you with dentures. And we can make really nice fitting dentures that, they'll take you there. If you have some teeth and you don't have a lot of bone or you don't have the financials, we can put you on partials. Partials are a great alternative. And not because it's all technology, you just have to jump into implants depending on your financials and depending also on how you're gonna end up restored with a partial or an implant. Sometimes an implant will not look good, whereas a denture will look better. So those are the alternatives that we have. How would a bridge compare to dental implant? Well, if it's a fixed bridge, we can do fixed bridges with your teeth, or we can do a fixed bridge with a dental implant. And what that means is that it's a prosthesis that is glued to your teeth or the implants, or screwed to the implants, and it's not gonna move. That's very comparable. You can also have a partial, and a partial would be comparable to an overdenture that snaps into the implants. But this partial, instead of snapping into implants, is snapping into your own teeth. So you have alternatives, different costs, and solutions for the long term.